Hi, and good afternoon, everybody. I am Tina Dale with the Fairfax County Health Department, and today we're going to be talking about treatments for COVID-19 infection. So, as many of you might be very well aware and recall that the health department has promoted and advocated for vaccination, encouraging folks to become fully vaccinated against COVID-19 as one of the best ways to prevent illness. However, there is a new tool in the toolbox, actually a few tools in the toolbox that can be administered to folks who happen to be ill with COVID-19 to help mitigate any sort of serious complications. Joining me to talk about this today is Dr. Benjamin Schwartz. Dr. Schwartz is our epidemiologist for our Division of Population Health here at the Health Department. Welcome, Dr. Schwartz. It's so nice to have you with us today.
Thank you, Tina. It's great to be here.
So, Dr. Schwartz, tell us what type of treatments are now available for people?
There are two different types of treatments. One is the antiviral drug. And the way antiviral drugs work is they attack the virus that causes COVID. The other group of treatments are called monoclonal antibodies. And these are substances that are given to a person with COVID to temporarily increase their immunity to COVID and increase their ability to fight off the infection. Among these two different classes of treatments, the ones that are easiest to take are the antiviral drugs, which are given as pills and can be used among people who are not hospitalized, who have mild or moderate COVID infection and want to prevent that infection from becoming more severe.
So, who are these treatments designed for?
The COVID treatments are for people who are at increased risk for developing more serious illness that may lead to hospitalization or could even lead to death. These people who are at greater risk are those who are older, and we often talk about older than 65 years, but it could be other older adults who may not have yet had their 65th birthday, as well as people who have various underlying medical conditions. This may include things like chronic heart disease, lung disease, diabetes. It may include people who have suppressed immunity because of either a disease or a medication, or it may include people who have obesity, women who are pregnant, and other groups as well. So if you think that you may have a condition that increases your risk for severe COVID, talk with a healthcare provider about that, and they can work with you to determine if you're one of those individuals at increased risk.
That's great information. So, for those who are just tuning in, we are talking with Dr. Benjamin Schwartz about COVID-19 treatments that can help prevent or help decrease the seriousness of COVID-19 infection. So, you shared that these treatments are primarily designed for those who have underlying health conditions that would put them at greater risk for infection, including some very things that we wouldn't necessarily consider in the general public as a high risk condition, but obesity, pregnancy, diabetes, other underlying health conditions, and including those who take immunosuppressant drugs. So, some of the drugs that you described, can you talk about how effective these are?
There was an expert panel from the National Institutes of Health that looked at all of the various treatments, and they looked at the evidence, and the drug that came out on top as the most effective is a drug that's called Paxlovid. In a clinical trial of Paxlovid, before the drug was approved by the FDA, they looked at the ability of people who received this treatment to um, prevent hospitalization, to prevent more severe illness. And what they found was that the drug was 88% effective in preventing that more severe illness and preventing hospitalization or death. They also found that among people who took this drug, who took Paxlovid, that there were 0 deaths, that nobody died, compared with 12 deaths in a comparison group that did not take the drug. And so it really had very high effectiveness in preventing that more severe illness from COVID.
That's significant. So, say for example, I'm not feeling well, or I possibly have been exposed to somebody who did test positive for COVID-19. I either do a home test or I go to my doctor and find out through him, through testing in the office, that I do indeed have COVID. So, what should I do when I find out that I'm positive with COVID-19?
For the um, antiviral drugs to work, they need to be started early in the course of infection. And so the FDA has approved these drugs for use within 5 days of becoming ill. So once you have the test, once you have the positive test result, it's important to see a healthcare provider soon in order to get a prescription for the antiviral drug, begin taking that drug, and prevent disease from becoming more severe.
So we've heard the term test to treat centers or test to treat. Can you talk a little bit about that?
There are 2 ways that you can get these antiviral drugs. One is if you've had a positive test, you can go to a healthcare provider, and the healthcare provider can prescribe the drug, and you can pick it up at one of several hundred pharmacies in the Northern Virginia area. A second way to get the treatment is to go to a pharmacy that has a clinic. And this may be, for example, a minute clinic at a CVS pharmacy. And you can get a test done at that clinic. And then if the test result is positive, you can have the drug dispensed right then and there. So it's really one-stop shop for getting tested and then, if positive, getting treated.
And are there costs that are associated with some of these treatments or any of these treatments?
It's really important to emphasize that there is no cost for the medication. Paxlovid, for example, has been purchased by the federal government, so it is dispensed for free. Also, there is no cost for getting the test done. If you do go to a test for treatment center at a pharmacy, there may be a consultation cost, but that cost is entirely paid by health insurance or by Medicaid. Although if you have no health insurance, you may be responsible for paying that consultation fee.
So, say for example, I've been tested. I don't have any underlying health conditions that I'm aware of, and I feel okay for the first few days. But maybe starting day 4, day 5, that I really start to feel ill. Could I take advantage of some of these treatments?
If you don't have any conditions that put you at higher risk, then the best thing to do is to use symptomatic treatments, to
Okay.
take Tylenol or take ibuprofen if you have a fever. And so treat the symptoms. But if you're not sure, if you're beginning to feel worse and you're not sure, talk with a healthcare provider, and they can go through the list of conditions that would make someone eligible to get this treatment. And if you do have one of those conditions, you could very quickly get a prescription and start treatment.
Fantastic. Thank you. That's very good information to hear. So we do see that there are cases, COVID-19 cases are increasing in our region, and this is great information to have on hand. But can you share with us? Because some of us might have forgotten, or really, so much time has passed since the beginning of the pandemic, that maybe some of us have kind of forgotten some of the key steps we should take when we do become positive. So can you run through some of those? So if someone does test positive, what should they do?
If you have a positive test, the most important thing is to stay home and away from others. And when I say stay away from others, it means both others in the community, obviously, if you're staying home, but also isolating from others in your household. So have a separate room, stay away from others so you don't get them infected by COVID as well. After 5 days of isolation, then you're able to go back out into the community and be with others. But for a 5 day period, so between day 6 and 10, you should consistently wear a well fitting face mask because there's a possibility that you're still contagious and could make others sick. And so if you are positive, really the most important thing is making sure you don't spread that disease to someone else.
Excellent information, Dr. Schwartz. Thank you so much for talking with us today and talking about the available COVID-19 treatments. Again, these are primarily for folks who do have underlying health conditions and who might be at greater risk of complications from a COVID-19 infection. And as a reminder for those folks who might not be eligible for these treatments, there are over-the-counter treatments to help with fever, but always consult your healthcare provider, especially if you have questions. And then please don't forget, if you do have COVID-19, stay home if you're sick. Continue to isolate yourself from others. And between days 6 and 10, wear your mask to ensure that you are not spreading the virus to others. Dr. Schwartz, is there any other information that you would like to share with us today?
Well, you began by talking a little bit about vaccination, and I'd like to link the concepts of vaccination and treatment. So, first of all, vaccination, as we all know, is one very important way to prevent serious illness and infection with COVID. It's important not only to get the first 2 doses, that is, to complete the primary series of vaccination, but also to stay up to date and to get a booster dose if you're eligible for that booster. So I really want to emphasize vaccination. But we know that many people in our community still have not been vaccinated or have not gotten that booster dose. And so those are the people for whom treatment with an antiviral drug, with a drug like Paxlovid, is particularly important. But that's not to say that somebody who has been vaccinated is not eligible for treatment, because if you have been vaccinated, you would still be eligible to receive an antiviral drug if you have those underlying medical conditions or are an older adult. And so I really want to tie those two concepts together. Get vaccinated, but if you choose not to be vaccinated, be aware of the availability of treatment because it really can prevent that severity, keep you out of the hospital, and keep you from getting more sick from COVID.
Excellent information, and thank you for that message, Dr. Schwartz, and for talking with us today. So, again, for people who would like to find out more information about the COVID-19 treatments that are available, please take a look at the web address below. This is a Health and Human Services site where you can receive more information about treatments. And if you would like to get more information about COVID-19 in general, feel free to visit our website at www.fairfaxcounty.gov/health/novel-coronavirus. So thank you again, Dr. Schwartz. It was very nice to speak with you today.
Thank you, Tina.
And for everyone who tuned in today, thank you so much for watching, and we hope to see you again next time.